Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Best cold medicine OTC treatments for your symptoms. There is no cure for the common cold, but the best cold medicines help to ease symptoms so you can relax and recover. To find an over-the-counter, OTC, medication that is right for you, you need to consider your symptoms and know which cold relievers target them. /r/n/r/n decongestants, for example, can help improve stuffiness, analgesics can reduce pain and fever, and other types of medications can help with problems like coughing and sneezing. /r/n/r/n This article walks you through the various types of cold medicines and how they work, so you can choose the best one for your cold and flu symptoms. /r/n/r/n Antibiotics are not good for colds because colds are caused by viruses. Antibiotics treat infections caused by bacteria, not viruses. /r/n/r/n Congestion is a hallmark symptom of colds and flu. It's caused by swollen blood vessels in the nasal passages and airways. /r/n/r/n Over-the-counter, OTC, decongestants narrow these blood vessels and decrease inflammation. This helps airflow and mucus drain. /r/n/r/n Decongestants come as pills, tablets, liquid, and nasal spray. Oral decongestants include /r/n/r/n Nasal sprays contain oxymetazoline. They deliver relief directly to the nasal passages. OTC brands include /r/n/r/n Decongestants can raise your blood pressure. If you have high blood pressure, make sure to choose cold medications that do not contain decongestants. /r/n/r/n Analgesics are painkillers and fever reducers. Common OTC analgesics include /r/n/r/n in children with a cold or other virus. Aspirin or other salicylate medicines increase the risk of Reyes syndrome. Children under 18 shouldn't take aspirin unless specifically instructed to by a healthcare provider. /r/n/r/n Aspirin and acetaminophen may work better for fevers and headaches. Ibuprofen and naproxen may be better for body aches. /r/n/r/n For fevers above 102 degrees, it may help to alternate between acetaminophen and ibuprofen. Adults may alternate between these two medications every 3 hours. That's especially true if the fever comes back as the medication wears off. /r/n/r/n Always check labels to see what the active ingredients are, especially if you are planning to take more than one medication at a time. Combining cold medications can cause you to take too much of one or more active ingredients, which can lead to dangerous side effects. /r/n/r/n Taking too much acetaminophen can cause potentially fatal liver damage. Don't take more than 4,000 mg, mg, of acetaminophen per day. This drug is in dozens of OTC products. Read labels closely to make sure you don't take more than one product containing this drug. /r/n/r/n The best medicine for a cough depends on your symptoms and the type of cough you have. /r/n/r/n The time of day also matters. If you need to quiet a cough so you can sleep, an antitussive medication is a good choice. /r/n/r/n Dextromethorphan is an antitussive. It works to quiet a cough by turning down the cough reflex. Cough medications that contain DM in the name contain dextromethorphan, including /r/n/r/n During the day, you cough to clear mucus from your lungs. If the mucus isn't removed, it can lead to pneumonia or other lung infections. For this reason, it's best to only take cough medicine if your cough becomes painful and you're having trouble clearing mucus on your own. /r/n/r/n An expectorant loosens chest congestion and thins mucus so it can drain. It doesn't stop a cough, it helps your cough remove mucus better. /r/n/r/n The expectorant guaifenesin is the only expectorant approved by the FDA. It's in multiple brand name products, including /r/n/r/note. Cold medicine isn't recommended for children under 4 years of age. And kids between 4 and 6 should only take cough medicine under a healthcare provider's supervision. /r/n/r/n multi-symptom formulas typically include a combination of /r/n/r/n. These treat many different cold and flu symptoms in one dose. But they should be used with caution. /r/n/r/n always read the ingredients list. Make sure the product only includes drugs that treat symptoms you have. /r/n/r/n don't take other medications or you could risk an accidental overdose or drug interactions. For example, if a medicine contains acetaminophen, don't also take Tylenol, Midol, or Excedrin, because they also contain acetaminophen. /r/n/r/n also, don't take cough syrup with multi-symptom products that contain dextromethorphan or guaifenesin. You may get a dangerous double dose of those drugs. /r/n/r/n if you are already taking prescription medication, call your provider and ask if it is okay to also use an OTC medication for your cold. /r/n/r/n some people turn to natural treatments or home remedies for cold and flu symptoms. But certain supplements can interact with OTC medications. Talk to your healthcare provider or pharmacist before using a supplement plus an OTC cold or flu product. /r/n/r/n antihistamines don't provide significant relief for cold symptoms. They work by blocking the chemical histamine, which your body releases in response to an allergen, such as pollen or dust. /r/n/r/n common antihistamines include /r/n/r/n antihistamines relieve congestion related to allergies. But their effect on the common cold is questionable. /r/n/r/n a review of 18 high-quality trials found antihistamines may help relieve congestion during the first 2 days of a cold. They're less effective on day 3 or later. /r/n/r/n some antihistamines have side effects including /r/n/r/n talk to your healthcare provider before taking antihistamines if you have colon /r/n/r/n in addition to reading ingredient lists carefully. There are a few other tips to consider when treating a cold with OTC medicine. /r/n/r/n first, never give cold medicine to a child who is younger than 6. Cold medicine will not help them and could result in dangerous side effects. Instead, try natural remedies such as lemon and honey. Do not give honey to children under the age of 1 year. /r/n/r/n you should also avoid taking cold medicine if you are pregnant. /r/n/r/n keep in mind that even the best cold medicine will not cure cold itself. Cold medicines only relieve your symptoms while your immune system fights the virus. /r/n/r/n while taking cold medicine may be helpful, it's important to also provide your immune system with the support it needs by /r/n/r/n multi-symptom cold medicines can help to quickly relieve a cold for several hours, but they won't get rid of the cold. There is some evidence that the mineral zinc can help to shorten the duration of a cold. Zinc is the main ingredient in Zicam, a homeopathic medication marketed to end colds faster. /r/n/r/n always take the proper dose of a medication, which should be listed on the medication's label. If you feel that you need a stronger dose than what is listed, or you need to take the medication more frequently, call your healthcare provider. /r/n/r/n most cold symptoms go away within about a week. If your symptoms get worse or do not get better within 10 days, call your provider. Your provider may wish to test you for sinus infection, allergies, or another illness. /r/n/r/n should you experience any of the following symptoms, call 911 or go to the emergency room right away. /r/n/r/n knowing what cold and flu medicines do helps you choose the best medication for your symptoms. Decongestants help clear stuffed up nasal passages and airways. Analgesics treat pain and fever. /r/n/r/n cough suppressants treat dry coughs. They also quiet a cough so you can sleep. Expectorants loosen up phlegm in your lungs and help it drain. They're good during the day for wet coughs. /r/n/r/n with multi-symptom treatments. Look for one with ingredients that match your symptoms. Read labels of everything you take to avoid doubling up on a drug. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.